October is National Audiology Awareness Month, and to highlight this, we will be diving into the basics of hearing healthcare. My name is Dr. Nicole Oldrati, and I am one of the clinical audiologists at Coates Hearing Clinic. Some key points we will touch on in this presentation are listed here. We will talk about what an audiologist is, the warning signs of hearing loss, some statistics. We will discuss health conditions that are linked with hearing loss, what to do if you think you have hearing loss, what are the different types of hearing loss, and what are those treatment options. Let's start with what an audiologist is. An audiologist is a healthcare professional who diagnoses and treats hearing, tinnitus, and balance problems. An audiologist does 4 years of undergraduate school to achieve a bachelor's degree and then continues to graduate school for 4 more years to earn a doctorate in audiology. The 4 years of graduate school also includes a 1-year residency or externship. Who we are. Coates Hearing Clinic is a family-owned private audiology practice by local Smithfield residents, Dr. Kathleen Coates and her husband Jordan. We take time with each patient to learn their unique history in order to determine the best treatment, whether that's hearing aids or something else. Audiologists are able to do a vast quantity of services in the field. We perform comprehensive hearing evaluations, work with hearing aids and cochlear implants, evaluate and treat tinnitus and balance issues, and help with preventative hearing loss strategies. Tinnitus is a term that covers any sound in the ears or head. This can be ringing, buzzing, hissing, crickets, whooshing, or something else entirely. Tinnitus can be constant or come and go, and it can be present in both ears or just one. Because our balance system is so closely linked to our hearing system, patients with untreated hearing loss have a 3 times higher risk of falling. That risk continues to increase with the severity of the hearing loss. Next, let's discuss some warning signs of hearing loss. Some common complaints we hear from patients are listed here. Many people with hearing loss need to ask people to repeat themselves and believe their friends and family are mumbling. People with hearing loss may also start to withdraw from social activities due to difficulty hearing and keeping up with conversations. They find difficulty in more complicated settings where background noise is prominent. Let's talk about some numbers next. Around 48 million Americans report some degree of hearing loss, and almost the same amount of people report having tinnitus. There are many health conditions that are linked with hearing loss. In this presentation, we will go through some high-risk groups and some health conditions that are linked to hearing loss to better understand that link. Here are some different health conditions that have a link to hearing loss. Poor cardiovascular health affects both peripheral and central hearing systems. Patients who suffer from hypertension or high blood pressure can have an increased risk of developing hearing loss as well. Hearing loss is about twice as common in adults with diabetes. The elevated blood sugar levels can cause chemical changes that impact the nervous system, which in turn can damage the hearing nerves. Many chemotherapy medications and radiation are ototoxic, which means they are harmful to the inner ear, and they can cause hearing loss. 54% of patients with moderate kidney disease report having hearing loss. Let's talk a little bit more about age. Age-related hearing loss is also called presbycusis. There are 33% of Americans between the age of 65 and 74 who experience hearing loss, and nearly 50% of Americans report hearing loss ages 75 and up. There are some other statistics noted on the screen that break down the number of adults with hearing loss based on different age groups. A baseline hearing evaluation is always recommended for anyone who is over the age of 50. So, you think you might have hearing loss. What do you do now? When a patient comes in for a comprehensive hearing evaluation, there are multiple steps taken to get as much information as possible about the ear. We start off by looking in both ears to check for wax, and if wax is present, it will be removed. The eardrum and 3 small bones of the middle ear are tested as well as the hearing organ. The ability to detect sound, or a beep, is only one part of the test. Your speech and word processing will also be tested to see how well your brain is able to process speech in quiet and in noise. Will my insurance cover this visit? Most health insurances will cover a comprehensive hearing evaluation as a preventative measure each year. Depending on your insurance, a copay may be required for this appointment. During the comprehensive hearing evaluation, audiologists are able to determine the type of hearing loss a person has. There are 2 main types of hearing loss. We will start with conductive. A conductive hearing loss is defined as an issue with the eardrum or the middle ear bones that can cause a blockage of sound from getting to the inner ear or the cochlea. This can be caused by pressure or fluid around the eardrum, or even a hole in the eardrum. It can also be caused by the ossification or disarticulation of the middle ear bones. This type of hearing loss may be able to be medically or surgically corrective, as the hearing nerve itself is functioning fine. The second type of hearing loss we will discuss is called sensorineural hearing loss. This is the most common type of hearing loss. Sensorineural hearing loss is defined as damage to the hair cells in the inner ear or the cochlea. This damage is typically permanent and can be caused by noise exposure, family history and genetics, wear and tear over time, aging effects, as well as varying diseases and disorders. Some of these examples are listed on the screen for you. Something people do not realize is that hearing does not happen only at the ears. Our ears hear sound, yes, but we actually hear with our brains. It's the brain's job to process and interpret the incoming sound. Sound travels through the ear and up the auditory pathway until it reaches our brain for processing. All right, let's now discuss some treatment options. The most common type of treatment for hearing loss is hearing aids. 60% of people who experience hearing loss utilize hearing aids. It is important to see a doctor before purchasing hearing aids because the FDA has regulations on different types of devices. Hearing aids are not a quick fix. They are only one part of the treatment plan. Yes, hearing aids give you back access to sounds, but you are hearing through a damaged auditory pathway when you have hearing loss. Communication strategies and auditory rehabilitation plans are sometimes recommended as part of the plan as well. The provider will need to treat both the hearing loss and the way the patient hears and listens in certain environments. Initial programming is tuned for every pitch, and verification is done with the hearing aids and the patient's ears to ensure a proper fit and proper programming of the devices. Further fine-tuning and reprogramming of the hearing aids may need to be done if there's any change in the hearing. All right, we have made it to the end. If you have any questions or feel like you need to schedule an upcoming appointment with your audiologist, please give our clinic a call at 919-300-5438. Our website is also full of wonderful information if you'd like to learn more about something that was discussed in this presentation. Make sure to like us on Facebook, if you've got a Facebook, for any upcoming events and to stay in the know of what our clinic is up to. If you haven't given the clinic your email already, please do so you can receive all of our monthly informative newsletters. Again, thank you so much for listening. My name is Dr. Nicole Oldrati, and I hope to see you around the clinic soon.